Did you know that the plan millions of seniors are choosing to save money could actually cost you everything: your doctor, your coverage, and your freedom to get the care you need? If you or someone you love is on Medicare Advantage, or thinking about signing up, there are things the insurance companies simply will not tell you unless you sit down and specifically ask the right questions. Today, I'm going to be that trusted friend who tells you the truth, so stay right here, because what you're about to hear could protect your health, your wallet, and your peace of mind for years to come. If this sounds like something that matters to you, go ahead and hit that like button, subscribe so you never miss an update, and when we're done, tell me in the comments, are you on Medicare Advantage, and did you know any of this? Now, let's start at the very beginning, because to truly understand what's going on with Medicare Advantage, you need to understand how it differs from what most of us grew up knowing as regular Medicare. Original Medicare, Parts A and B, has been around since 1966. President Lyndon B. Johnson signed it into law, and Truman was the very first person to enroll. It was built on a simple, beautiful promise: you pay your premiums, you go to any doctor in the country who accepts Medicare, and the government helps cover the bill. No middleman. No gatekeeper. Just you and your doctor making decisions about your health. Medicare Advantage, on the other hand, came along much later. It's offered by private insurance companies, names you recognize, like Humana, United Healthcare, Aetna, and the government pays those companies a set amount to cover your Medicare benefits. In return, these plans often advertise $0 premiums, extra perks like dental, vision, gym memberships, and hearing aids. And I want to be clear, for some people in good health, living in one place, with access to a solid network of doctors, these plans can work just fine. But here's where things start to get complicated, and where the things they don't tell you can really begin to matter. The very first hidden reality I want you to know about is something called prior authorization. Now, that's a fancy term, but let me put it in plain English. In original Medicare, when your doctor says, you need an MRI, or, I want to send you to a cardiologist, or, after your hip surgery, you need to go to a rehabilitation facility, that's what happens. Your doctor decides. That's the way medicine is supposed to work. But with nearly all Medicare Advantage plans, before you can get many of those same services, the insurance company has to approve them first. That process is called prior authorization, and it puts a gatekeeper, not a doctor, but an insurance company, between you and the care your physician recommends. Now, here's the number that really stopped me in my tracks. In 2024, approximately 7.7% of all prior authorization requests were initially denied by Medicare Advantage plans. That might not sound like a big number, but think about what that means in human terms. Imagine being told by your doctor that you need a procedure, and then waiting days or even weeks while a clerk at an insurance company decides whether they agree. And here's the part that really raises questions: over 80% of those denied requests, when appealed, were eventually overturned. More than 80%. That means the vast majority of those initial denials should never have happened in the first place. But many seniors don't know they can appeal. Many don't have the energy or the know-how to fight back. And so, far too often, people simply go without the care they need, or pay out of pocket in desperation. The second thing they won't always tell you up front is about network restrictions and what's sometimes called the snowbird problem. Medicare Advantage plans typically operate within a specific geographic network of doctors and hospitals. If you live in Florida but spend summers in Ohio, or anywhere else, your plan may only cover emergency care outside your home region. Routine checkups, follow-up appointments, specialist visits, those might not be covered at all if you're out of your plan's area. And there's an even trickier situation right here. Doctors can leave a plan's network at any time during the year. Not just at the start of the year, but mid-treatment. So you might start a course of care with a doctor who's in your network, and then one day receive a notice that they've left the plan. Suddenly, the continuity of your care is disrupted, and you have to start over with someone new. For those of you who travel, who love the freedom of moving between places with the seasons, or who have family in different parts of the country, this is a very real and very important thing to think about. Original Medicare doesn't have this problem. With Original Medicare, you can walk into virtually any doctor's office anywhere in the United States that accepts Medicare, and most do, and receive covered care. That flexibility is something money can't easily replace. Now I want to talk about what I consider the most critical hidden fact of all, something that financial planners and Medicare counselors call the Medigap trap, and it's something that can quietly close a door on you without you even realizing it until it's too late. When you first turn 65 and enroll in Medicare, you have a guaranteed window, usually 6 months, during which you can purchase a Medigap supplemental policy from any private insurer without being subject to medical underwriting. That means they cannot deny you, and they cannot charge you more because of your health conditions. It's one of the most powerful protections in the entire Medicare system. But here's what happens if you choose Medicare Advantage instead during that time. You use up that window. You pass through that golden period. And if, years later, you decide you want to switch back to Original Medicare, perhaps because your health has changed, your doctors left the network, or your plan cut benefits, you may find yourself trying to buy a Medigap policy in a very different environment. Now, private insurers can ask about your health history. They can charge you much higher premiums. In many states, they can deny you coverage altogether if you have pre-existing conditions like diabetes, heart disease, or cancer. This is the trap. You went in healthy. You chose a plan with a $0 premium and some nice extras. But life happened, as it does for all of us, and now when you need the most comprehensive coverage the most, the door to getting it may be closed. This is not a scare tactic. This is the reality that tens of thousands of seniors have lived through, often with tremendous regret. Let's also talk about money, because that's almost always part of the decision. Medicare Advantage plans are often marketed heavily on their low or zero monthly premiums, and that's genuinely appealing, especially for those of us on a fixed income. But the full picture requires looking at what's called the out-of-pocket maximum. In 2026, the federal limit for in-network out-of-pocket costs under a Medicare Advantage plan is $9,250. That means if you have a serious health year, a hospitalization, a surgery, a major illness, you could be paying thousands of dollars in co-pays and co-insurance before that protection actually kicks in. Now compare that to a Medigap Plan G, for example. You pay a predictable monthly premium, and in return, nearly all of your out-of-pocket costs under Original Medicare are covered. For someone in good health, the math might favor Medicare Advantage. But for someone managing multiple health conditions, the math can flip dramatically, and the surprise bills can be devastating. I also want to make sure you're aware of some very significant changes happening right now in the Medicare Advantage market for 2026, because the landscape is shifting in ways that directly affect people who are enrolled today. Major carriers like Humana and United Healthcare are pulling out of certain counties and rural areas entirely. If you live in one of those areas and your plan is leaving, you'll be forced to find new coverage, and that search may not come with as many good options as before. At the same time, many plans are scaling back on the extra benefits that made them attractive in the first place: the dental coverage, the vision benefits, the gym memberships. Those perks are being cut as insurance companies struggle with rising costs. But here is one piece of genuinely good news coming in 2026. For the very first time, Medicare Advantage plans are now required to publish lists of all the services that require prior authorization, along with their approval and denial rates. That's a meaningful step toward transparency. It means you can actually look at a plan and see, before you enroll, how often it denies requests for the kinds of care you might need. That's information that simply wasn't available before, and it's something I'd strongly encourage every single one of you to look at when comparing plans during open enrollment. So what does all of this mean for you? Well, it means that choosing a Medicare plan is one of the most important financial and health decisions you will ever make, and it deserves careful, informed consideration with all the facts on the table. It means asking your insurance agent or Medicare counselor the questions that don't always come up on their own. What services require prior authorization? What is this plan's denial rate? What happens to my coverage if I travel? What are my rights if I want to switch back to Original Medicare someday? These are not hostile questions, they are your right to ask, and any trustworthy advisor will welcome them. There is no one-size-fits-all answer here. Some people will be perfectly happy with their Medicare Advantage plan for many years. Others will find that the restrictions, the network changes, or a serious illness reveal the limitations in ways they wish they had known about sooner. The goal today was never to tell you what to choose, it was to make sure you have the full picture, the honest picture, so that whatever you decide, you're deciding with your eyes wide open and your interests fully protected. In just a moment, we're going to wrap things up with a few concrete, practical steps you can take right now, whether you're already enrolled in Medicare Advantage, considering it, or helping a parent or loved one navigate these decisions. You won't want to miss this, because knowing what to do next is just as important as understanding the problem.